How does mood-incongruent psychosis manifest in bipolar? Imagine experiencing a vivid hallucination or holding a firm belief that just doesn't match how you're feeling at the moment. That's what mood-incongruent psychosis is in bipolar disorder. It happens when the psychotic symptoms, like delusions or hallucinations, don't align with the current mood state. And like mood-congruent psychosis, where the symptoms reflected the mood-incongruent symptoms seem out of place or even opposite. For example, during a depressive episode, a person might have bizarre or persecutory delusions that don't fit sadness or worthlessness. Instead, they might believe they are being watched or targeted, which isn't typical for depression. During mania, psychotic symptoms could include paranoid delusions or beliefs that thoughts are being inserted into their mind, which don't match the usually elevated or expansive mood. People with bipolar disorder who experience mood-incongruent psychosis often report delusions like thought insertion, where they believe someone is putting thoughts into their mind, or thought withdrawal, feeling like their thoughts are being taken away. They might also have hallucinations that aren't related to their mood, such as hearing voices that comment on unrelated topics or experiencing sensory illusions like strange smells or tactile sensations. These symptoms tend to be more intense and can lead to longer hospital stays, more severe illness courses, and poorer overall outcomes. Mood-incongruent psychosis is more common in bipolar I disorder, especially during depressive episodes, but it can also occur during manic episodes. It's often linked to higher levels of agitation, anxiety, and hostility, and it can make diagnosis more challenging because the psychotic symptoms don't match the mood. This can sometimes lead to confusion with primary psychotic disorders like schizophrenia, but careful assessment helps distinguish between them. It's important to understand that psychotic symptoms, whether mood-incongruent or mood-congruent, are common in bipolar disorder. They include fixed false beliefs and perceptual disturbances without external stimuli. Recognizing the difference helps clinicians plan the best treatment approach. In summary, mood-incongruent psychosis in bipolar disorder involves bizarre or unusual delusions and hallucinations that don't match the person's current emotional state. These symptoms often indicate a more severe form of the illness and requiring careful management. If you or someone you know experiences such symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment tailored to individual needs.